Hi, and welcome to Tharaka Foundation's YouTube channel, Supporting the Whole Child. We just wanted to give you a quick disclaimer saying that everything that is found on our YouTube channel is created for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something that you have heard or seen on this YouTube channel. Thank you so much, and without further ado, let's begin today's video.
Hello everyone, welcome to the Tharika Foundation YouTube channel, Supporting the Whole Child. I'm your host Poonam, and with me Dr. Leena is there to educate us. Today we are starting a new series on depression. So my first question from Dr. Leena is, what is depression?
So thank you for having me back, Poonam. We are entering in our new series of mood disorders, and depression is one of the mood disorders. We completed the anxiety series. Hopefully people have watched that and have found that helpful. So, we definitely use this term of I'm feeling depressed or depression much more easily and commonly in today's world. But we also need to understand that there is a difference between what we call as clinical depression versus feeling depressed every now and then. So when circumstances in life are difficult, and if there is a clear stressful event like losing someone near or dear, or loss of something important otherwise, or a big disappointment, friendship kind of breakup, a lot of things can be events that can trigger sadness in mood. And so we can go through waves of feeling depressed during those times or feel sad, but that does not qualify as clinical depression the way we as psychiatrists or therapists in the mental health field understand. So let me tell you about what is clinical depression. And it is important for viewers to really understand that so they don't panic if their child is sad or feeling down for a few days after break up with a friend or girlfriend, or they are down or depressed because they got a bad grade, or it was related to a loss of a pet or something like that. So when we say that somebody is clinically depressed, or they have what we call as, in our more formal term, major depressive disorder, that entails them having a lot of the symptoms, and I'll go over each of those, along with just not having those many symptoms. They also need to have duration of time during which they've been feeling that way. So there is a number of symptom criteria and there is a duration criteria for us to really say this is little more than just a dip in the mood or situationally triggered sadness of mood. So generally we talk about 9 symptoms. And if you have 5 out of those that are lasting for 2 or more weeks, then you can qualify for a clinical depression diagnosis. So the things that we look for are, there are certainly what we call as mood symptoms, and then there are something we call as physical or neurovegetative symptoms. So what we understand is that when people experience sadness of mood for a prolonged period of time, along with that, if they have other changes, like they're having trouble with their sleep, either they are not able to sleep well or they are sleeping excessively. Other things like either they have decreased appetite or increased appetite, now that there is a big distinct change that they are either eating less or eating too much, and sometimes that can result into weight loss or weight gain. Along with that, there is decreased or increased energy. Mostly it's low energy, but in some subtypes of depression, people may have that opposite, increased energy or hyper kind of activity feeling. We call it as psychomotor retardation, when you have low energy and there's general slowness in your day-to-day movements, and day-to-day kind of life that can be visible. Or sometimes some people have what we call a psychomotor agitation, which may be completely opposite, that you can be restless and pacing and just like a little bit more fidgety and hyper and just more visibly different, kind of easily agitated, very irritable. And, often that type of depression is seen where people have a lot of anxiety along with depression. So, so far we talked about mood. So mostly it is sadness of mood, but sometimes it may be just difference in terms of just people being more irritable. So little things can snap them easily. They are grumpy and crabby, not happy about things, or little things can create a big lash out. Then sleep, appetite changes, energy level changes. Then motivation can be significantly impacted. Generally, we see a lack of motivation or low motivation. There is also lack of interest or loss of interest in things that are fun for you. So if your child used to love to do certain activities that they really were totally interested in and had too much fun in that, and they would want to do it at any cost and any price, and now suddenly they are shying away from doing that and not wanting to do that. They're isolating themselves. Their motivation to do things, including schoolwork, is down. They are more irritable than usual. They've been having sleep issues and appetite changes. Then those could be some red flags to be aware of. Besides that, as this condition progresses, we also see some other symptoms like feelings of low self-esteem. So losing confidence in one's ability, not feeling good enough, not feeling worthy, and feelings of hopelessness start to also trickle in over time. So people losing hope in life and for future. And then in extreme circumstances, if things have been actually progressing for a long time and there've been maybe repeated stress and other things that are just not helping, then untreated depression often also leads to having suicidal thoughts. So, thoughts to hurt themselves, harm themselves. It can range from just occasional like feelings or urges for self-harm. And we have seen a rise of that, particularly in our teens these days, that they use that as a method to deal with their severe emotional turmoil often. So they may cut themselves or do other ways of self-harm. And then sometimes it's more just this nagging thoughts of, I wish I was no more, I wish I ended my life. So it can go from something at the level of death wish to actually having a plan as to what I can do to do that, and intent when I'm going to do it. And so those are the things we definitely get very worried about when those things start to slip in. So for anyone to be getting diagnosed with clinical depression, you need to have 5 out of these 9 symptoms for at least 2 weeks in a row. So it's not like, 2 months ago I felt this like this for 2 days and then I felt fine, and then a month later I felt like this for another week and a half. So that doesn't count as 2 weeks of these symptoms. It has to be during that one single episode. If you're feeling this way for that much time and it's starting to affect your functioning, that's when it becomes a major depressive disorder or clinical depression.
Wow, thank you, Dr. Leena. It's a lot for me to digest. If I understand correctly, we are saying yes, life events do happen. And if you have that feeling of sadness, like big loss or some disappointment happens, that's fine, part of life. But if that feeling, like you shared 9 symptoms, if it happens for 2 weeks or longer, then definitely parents should keep an eye, and then they should consult and get that criteria checked. And if that child is meeting any criteria 5 out of 9, as you mentioned, parents should be taking that additional help from the health provider. Did I understand correctly?
That's correct. Yes. So Often in primary care physicians' offices, particularly pediatricians, now include these surveys to catch anxiety and depression early on. So there is one questionnaire that has been researched and validated that has all these 9, 10 symptoms that I mentioned. The 10th symptom is of all these symptoms are affecting your life in a big way. They are affecting your day-to-day functioning. So it's like you not only have to have 5 out of those 9, but you also have to meet criteria how significant or severe these are in terms of your day-to-day life functioning. So if you remember when we were talking about the term disorder, we had talked about like anxiety is normal emotion, we all have it, but for it to be termed or as described as an anxiety disorder, we need to have those symptoms as well as impact on day-to-day functioning, which is when it becomes a disorder. So I can feel depressed when I have a stressor of some sort, but as long as I'm still able to carry out my day-to-day life functions, my daily tasks, my daily routine, and it's not being impacted, then it is still not a disorder. Okay, so I think that is an important thing to also keep in mind. So in pediatrician's office, there is a questionnaire called PHQ-9. It's basically a questionnaire that 10 symptoms questionnaire, and they ask you to rate the frequency of those symptoms. How often do you feel this way? And those are usually given at least during annual visits when you're doing your child's well check visits. Most practices are including that these days. And so that could also be one way for your child to talk about it with your primary care doctor. And then if they see red flags there, they often, bring in you as well to talk about it depending on the age of the child.
Okay, that's good to know. It's part of your physical annual examination. But if parent is seeing any changes in child behavior, as you mentioned, sleep pattern or eating behavior or any other symptoms you mentioned, they can also get this on demand, like with their primary care physician. And if primary care physician thinks child has some certain level of depression, they can refer it to psychiatrist or therapist, depending upon the outcome of that survey. So, Dr. Leena, one more question is coming to my mind. Like we were talking about different kinds of anxiety disorders. So, do we have any spectrum here also, like level of depression or, severe versus low or medium? Like you were saying, for if you are functioning day to day, absolutely fine, you do feel depressed, but if it is longer, then we name it clinical depression. But are there any other forms of depression?
Yes. So, there are a few different ways to classify depression. So one is based on the severity of symptoms. So we say, is it mild depression versus moderate versus severe? So that is, of course, dependent on, like, you may have those symptoms, but if they are again, not interfering too much in your day-to-day life and are more, they kind of come and go. They're not predominantly affecting your day-to-day functioning, or they are present all the time during the day. Then, often we categorize that as mild. Once it starts to affect, your life more, then they go into that moderate and severe category. The questionnaire PHQ-9 that I was mentioning, gives us a score. So a score of 5 or above is considered to be in the range of clinical depression. By the way, this questionnaire is also freely available online. It's something, one can also take by downloading it, by searching it on Google, you can find it. And so if your child scores a score of 5 or above, then, it is significant for clinical depression, but then there is a little range. It's not listed on the questionnaire, but as providers, we have a bit more training to interpret that. So if it's 5 to 10, then you're in the mild range, 10 to 15 or 10 to 20 is moderate, and about 20 is severe. So that score also helps us determine the category of how serious this condition is for you. The other way of classifying depression is there is this understanding that depression can happen just by itself, and we call that as unipolar depression. So as I was mentioning in the very beginning, depression is one of the mood disorders. So under mood disorders, depression, or sometimes we say unipolar depression, and then there is something called as bipolar depression. And what bipolar depression basically means is that this person has a different type of mood disorder, illness called bipolar disorder. And the word bipolar basically entails that you're swinging between two different mood states. So you have this down state of mood called depression, and then you flip into this other state of mood, which is, this is our normal kind of mood, that this is where I'm in the equilibrium, where I'm neither too happy, not too sad. So there is this other end of the mood that sometimes people flip into. It's called mania, where you are suddenly feeling super happy, silly, giddy, on top of the world. You are having a lot more energy. You have big ideas, big plans. You have lots of racing thoughts. Often those people don't need much sleep during that phase, and they are on the go and being more and more creative and productive. Often they have grandiosity, meaning they start feeling like they are somebody special and they have some special connections, and some unrealistic, irrational kind of thinking. So that's a completely opposite mood state, and that condition unfortunately also exists where people swing between these two states. So they can go from depression to being manic for some time, and then they slip back into depression, and this kind of up and down course could continue. So that's known as bipolar depression. So a person who has a depression episode and they have been diagnosed as bipolar, they are struggling with bipolar depression. Another way to classify depression is also, we say that it's like more of melancholic or classic depression. So it's more of the very classic presentation of depression, like feeling really sad, slowed down by depression. People in this type of depression may say, I'm like feeling tired all the time. My motivation is down. I have hard time waking up in the morning and getting started with my day. I just have no interest in things. I am having trouble concentrating. I am, having trouble eating. I just feel like sitting and doing nothing, and I'm withdrawing and isolating more and more, and I just want to be alone. So that's kind of a classic kind of depression that mostly, again, seen more in adults than kids. In kids, depression looks very different. Kids, because they are young and they have a healthy brain and they are much more resilient, often you would not even realize this particular kid is actually dealing with some depression. On the outside, they may be seeming like they're getting A grades and they are thriving and doing multiple activities and keeping up with everything, but internally they are going through this emotional turmoil. So in kids, we see that because of their resiliency, they don't get too bogged down by the depression. Also, the flavor of the symptoms tend to be different. They have more of the irritability or increased irritability as a classic kind of change in behavior or symptom than sadness of mood. They do have social withdrawal and social isolation that tends to happen, but generally those things happen much later. So in kids, if there's a clear shift in their mood in terms of them being irritable and angry for little things and not being reasonable for things that you would be like, oh, this is a very different change in my child's behavior. He used to or she used to not lash out like this before. And of course, you need to inquire more if it's a situational stressor that's making them anxious and irritable, because irritability can also come from anxiety. But along with that, if there are other symptoms, then that's a way they present. Yeah, so that, I think generally covers the different types. And as I was saying earlier, sometimes people have a little opposite presentation of depression, like instead of decreased appetite, decreased sleep, and psychomotor retardation or slowness in their day-to-day functioning and walking and behavior, they may have this opposite kind of increased sleep, increased appetite, weight gain, and psychomotor agitation. Those can present in a different way, and this is called as atypical depression. So more of classic depression symptoms are classified as typical depression, and when somebody has opposite type of symptoms, that's an atypical depression.
Okay. That's a lot of good information for us, Dr. Leena. I wanted to ask you one question. You mentioned about the questionnaire. Is this questionnaire common for adults and children, or are they separate?
No, it is. So children about age 8, it is relevant from that age on to adults. So for younger kids below age 8, we use a different rating scale to, I guess, diagnose, not necessarily diagnose. Questionnaires are not diagnostic, so I don't want people to think that, oh my gosh, after hearing this information, they go and they download the questionnaire and they start rating themselves and they already find a score of 6 or 7. I don't want people to panic and think that, oh, I have clinical depression, my life sucks, or I think sometimes there are overlapping symptoms of some other conditions like, anxiety can also have impact on your concentration, your motivation. If people have other conditions like ADHD, attention deficit hyperactivity disorder, they struggle with concentration, motivation, and feeling sad because they're not doing as well in school. So questionnaires are not diagnostic. They definitely are just an additional tool to use in addition to a proper clinical assessment to add to what we already hear or from the parent or from the child. And then if we also see there are red flags on the questionnaire, then it kind of adds up to some meaningful kind of diagnosis or a way to confirm the diagnosis. But if you are seeing some elevation for some reason in your questionnaire, it's still a good idea to consult with your pediatrician or, talk to your child and gather more information and relay that to your doctor or a school counselor. And you can start the ball rolling and just get some additional information so you are reassured that this is something related to just a situational thing or it's related to something else that your child might be going through, and it's not something to really worry too much about.
Okay, yeah, that makes sense. Just additional tool, just to if you want to do some self-assessment for yourself or for your child, you can just use it, but do not read too much between the lines. It's always a good idea to go to the right resources and right people to do their job. Wonderful. So, Dr. Leena, I have a lot of questions, but I'm sure we will address in upcoming episodes because I'm curious to know what happens, why it happens, what can we do to prevent ourselves before going to that stage where we need to see health providers. So I'm sure we will cover all these things in our upcoming episodes. So I would request my listeners to stay tuned for our upcoming episodes and gain a lot of information out of it. Thank you so much, Dr. Leena, for spending time with us and educating us. Really appreciate it.